Well, welcome. This is the first episode of our podcast, Between Visits, where we talk about smart healthcare and try to make it easier for Seattle area families. I'm Sean Park. I'm a pediatrician, and my practice is Lighthouse Pediatrics in Issaquah.
And I'm Dr. Judy Hsu, and I'm the owner and medical director of Myerstar Health, which is a clinic that's located in Bellevue, Washington.
And we are both direct primary care practices, and we'll talk about that a little bit later, but that's what makes our practices unique. But we both fundamentally are just primary care doctors. I'm in pediatrics, and Dr. Hsu is in family practice. And so the reason why we started this podcast is to bring more information about local healthcare in the Seattle area. Like, we want to really help. It's hard finding healthcare these days.
And especially, I think, information that you can really depend on, because there's so much slop on social now. A lot of mis and disinformation, and we just thought, why not just hear directly from your local community doctors that you can trust. So I think this is a really good way to get your health information.
Information and healthcare, just like learning how to get care, and then also learning about health and healthcare in general. So that's what this podcast will be about. Because families are just going through everything, like, we think that we practice in a way that helps them, but hopefully this will just wrap around and give parents more information, not just about us and the care around here, but we'll talk about topics. So today we're going to be talking about screen time and what makes that just so challenging for adults, families, and kids. But then also some upcoming healthcare news that'll really have an impact on people.
Yeah, absolutely. I think this is why the podcast title Between Visit is basically all the information we want to give you that we don't have time to give you in a single visit, right? So we want to fill you in on the local news and just, the latest trending topics in healthcare in general.
Yeah, that's definitely why we decided on the title.
I feel like it's very appropriate.
The first thing we want to help with is helping with healthcare, and so screen time is such a difficult problem for everybody. It's just so easy to get sucked into our screens these days.
No, even for myself, I definitely notice it. And I'm also still working on it. I'll be the first one to confess that, I find myself just mindlessly scrolling on Instagram. And I know it's usually times when I'm feeling stressed or just feeling like, I just need a little bit of energy boost. And then before you know, it's like 30 minutes has passed and I'm still scrolling on my Instagram. So, it's difficult for adults, even for doctors, so I can imagine how hard it is for kids.
It's like doctors who smoke. We know we shouldn't. And then I don't smoke, but I'm saying some of them do.
Was that a confession?
Right. No, it's hard. We know better. And we know that, we know like how it impacts us. We see how it impacts other people. It's still just hard not to do it.
Yeah. And definitely, I think, I don't know about you, but definitely in my own practice, I'm seeing a lot more parents, talking about this as a concern of theirs, about how much screen time their kids are getting, and how do we know how much is like enough or not enough? How do you utilize it in your life in such a way that it's not going to impact their development and their growth?
Yeah, for sure. I think it's generational a little bit. We grew up in a time where we can remember, maybe as just young kids, what it was like before we had anything in our pockets to carry on, but even like video games too. And things are just so different. And this generation and maybe the generation before it are the parents that are trying to figure out how to do this for their kids and themselves.
Yeah, I think life was simpler then.
Let's go back.
I feel bad for the kids today, to be honest. Life was definitely simpler then. I didn't get my first phone till college, and it was like a little Nokia phone with no smart features at all.
Yeah.
Seriously. Yeah, I feel like there's just too many choices these days. So
the other thing I see is that it's very age dependent. So we have teenagers, I'm sure, that our parents are really concerned are spending way too much time. They're not engaging. But then, a lot of the questions that I get are about the toddlers. How do we get the toddlers to begin healthy habits, not get sucked into them? And it comes up in so many different ways. And parents not only are struggling, they feel a lot of judgment around how they decide to do it. And there's no lack of people who are trying to tell them how to do it.
Yeah, yeah, yeah. I think that, I was alluding to the fact that for me personally, I was really struggling to control how much I go on my social and scroll through Instagram. And so, in a lot of ways, this really sort of reminds me of like how addiction works, and that there are a lot of things that we do in our lives that, over time when you do again and again, and if it makes you feel good, it sort of becomes this addictive pattern. And again, like just reminds me of like, if adults are struggling with this, how hard it must be for kids. So maybe we should like talk a little bit about sort of like why screen time is so like hard to get away from, and like what is that doing to like the brain.
So how do you explain to parents that part of it, the addiction part of it, or parents or adults?
Yeah, so I usually tell them that, look, like we have, these social media companies who have built this product that's meant to keep your eyeballs glued to the screen. So they actually have like tons of scientists and engineers that are working on this like day in and day out to make sure that you're spending as much time on that screen as possible. So they're building a product that inherently is rewarding for our brain. Every time we use it, it's supposed to make us feel good. That is what the product is supposed to do, right?
Yeah, for sure. A word I hear around here a lot, especially with all the tech workers in our area, is iterations. And the iterations that have gone into these social media products to get us just a little bit more hooked into their platform, has just gone on for, so many years now that they're really good at it.
Yeah, for sure. And so, just like anything else, like either with food or shopping or even gambling, right? Like addiction really comes to the fact that you have this behavior that's very self-enforcing, that's very positive and pleasant for our brain. Anytime that we engage in these activities, there's this sudden surge in dopamine in our brain that makes us feel good. And so that makes us want to go back and do more. And I think that's what screen time, especially social media, I think that's what that's doing for us, for our brains. And, especially for young developing brain like that of children, I think that's especially very difficult to help to regulate because, again, like I said, it's one brain versus 1,000 brain that have gone into designing this product.
That's a good way to put it. So the dopamine is, I think the big key there. How do you talk about dopamine with people like that, with your patients?
Yeah, I just tell them that dopamine is this kind of feel-good chemical that gets released in your brain, that anytime we do any activity that's like pleasant, basically there's a sudden release of dopamine in our brain. And again, over time, that becomes self-enforcing because our brain craves that dopamine hit. Yeah. Our brain craves that dopamine release. So we're going to want to keep doing activities that facilitate the release.
Right. Yeah, I talk about it very similarly. It's a survival thing that helps people look for food and shelter. And when they do activities that get them closer to those things, dopamine gets released. But it's been hijacked in this way that really gets people sucked into screens. Like they're really good at giving that dopamine hit to people.
Yeah, for sure.
So how do you go from explaining that to giving your families something to actually do about the screen time?
Yeah, I think just like anything else that, the technology itself isn't evil, it isn't bad. We just need to recognize that it's a tool and it could potentially be addictive. And how do we, integrate that into our lives in a way that's healthier? So, I don't think it's possible for us not to interact with technology. That's just not where we're going as a society, as a civilization. That is just where we're going. So there's no way around it. So it's about figuring out, how do we have a healthier relationship with technology? Yeah. How do you talk to your parents and your patients about it?
Yeah, I think it's balance. And I think that's what you were driving at too, is trying to get parents to develop that balance with their kids. And I think one of the first things that I go into is trying to figure out why the balance got tipped the wrong way. So there are, like you said, screens aren't the enemy. They're very useful in a lot of ways. But I find that usually there is one or a few common triggers, and I think they're generally emotion based. So one thing that I try to ask about with kids and teens are like, what are they using screens instead of? Are they bored? Are they lonely? Are they tired.
Mm-hmm.
And maybe we can find a better thing to do besides just pulling our phone out of our pocket and swiping.
So it's about sort of making it less mindless, is what I'm hearing you say.
Yeah, right.
Because a lot of times when we're feeling something, we can't quite put our words to it. We know it's a negative emotion, and before you know it, our phone's already in front of us.
Right.
So it's about kind of pausing intentionally for a second and trying to identify what is it that we really need at that moment.
I think so. I think, because if it were a cognitive issue, I think we all know that we can do less with screens, and it would be that easy.
Yeah.
When something is difficult, I usually look for like an emotional issue.
Yeah. How do you teach kids to do that? Like, I feel like this is something that probably is manageable with adults because they have a fully developed brain. But with kids, like, how do you? Sometimes, I
I mean, I'm not sure.
I don't know. Yeah, I'm not speaking for everyone, but I'm just saying, like, for kids, like, how do you usually like teach parents to instill that kind of again, that sort of more mindful use of technology in the kids?
With difficulty. It comes really slow, and I think you really have to start early.
How early are we talking about?
So in really small steps, I start talking to parents at 15 months, right when they start having, so at 15 months, we expect kids to have maybe 3 or 4 words, but understand anywhere from 20 to 50 words.
Yeah.
And what I say is start making some of those words emotion words. Talk to your 15-month-old. I see you're mad. I see you're hungry. I see you're sad. Not that I expect them to use those words, but just so they start having an understanding of what they are.
Okay.
And I think you really have to start that young, because when we get to the point where they can start reaching for a tablet or asking for your phone at dinner, maybe that's like 4 or 5. We can say, hey, I know you're bored. Let's find something else for you to do instead. And it makes more sense to do that if they already have an understanding of it.
Yeah, that makes a lot of sense. Like, to really address this problem, fundamentally, you have to teach kids how to identify their emotions, how to bring it to the foreground. So that's not just this nebulous feeling, and because, like, if you can identify it, then you know what to do with it.
Yeah.
Aside from just using the screen to soothe yourself or to make yourself feel better.
Right.
That's a really good point.
Soothing yourself is a big key. Like, we don't want screen time just to replace pacifiers, which is kind of what they can be doing a lot of the times, in kids at least.
Right. So what about the kids that maybe didn't really have that, that kind of experience with their parents early on, where they were encouraged to use their words to identify their emotions? Like, how would you correct course at that point?
Right. Yeah, it's difficult. The thing that I have to start with is just to normalize how difficult it is for parents who are in that situation that don't have a kid who already understands that. And by the way, even if they do, it's still really difficult. I think what that does is it opens the door to letting the parent be okay with not being strict all the time, just taking the screen away or not ever giving them the screen. But it says to them, sometimes you do. Sometimes you just have to make it more difficult for yourself than to keep feeding into this, as you said, kind of an addiction process for these kids.
So, like, don't do it like all or nothing. Like, that's usually that very black and white kind of strict approach is probably not the best.
Well, I would agree, and it's kind of like, I'm sure that you see with when you talk to your patients about weight loss or smoking cessation.
Oh yeah,
it's I mean, how many times do you say you need to go cold turkey?
Right. Yeah. Right. Yeah.
So yeah, that's the idea. But like, I know it's for kids, it's clear because parents have the control. It's not easy to use it. But for adults, if you feel like it's in the setting of an adult that is really not living life because they're having such because this is such a big problem for them, where do you start kind of unraveling that for them?
I actually talk a lot about social media and like screen time with my adult patient during their annual physicals, actually, as part of this sort of my comprehensive assessment, because I really sort of put that in the same bucket of like mental health, and mental health is very much a big part of like my annual physical assessment, wanting to make sure that not only your physical health is in good shape, but also your mental health is in good shape. So usually that's kind of where it comes up, unless, I do have some patient who, may approach me and tell me about like some of the things they struggle with. And then before we start talking about maybe the fact that they're feeling isolated because they feel like they're not, reaching out to people enough in their lives. Yeah. So I think that these conversations do come up here and there, for sure. And also definitely during wild child checks too, like for sure, like talking to kids about social media use, but also talking to parents about the fact that they need to model for their kids, right? Like it doesn't make sense to be telling your kids, like, don't go on the screen when you yourself are scrolling on the phone at the dinner table, right? So you need to like model that for your kids. And like you said, maybe let's start with modeling how to identify emotions. And, I think these are things that could be really helpful to make sure like everybody's on the same page in the family.
Yeah, I agree. And the, when it comes to how we withdraw from our lives when we get into screens too much, like how fine a line do you see between that and depression? When we start talking about real medical, clinical diagnoses.
Yeah, no, I definitely think that excessive screen use can really feed into the depression, because when you're doing that, you're not reaching out to socialize, right? We know that socialization is a really big component of like mental health and also really for brain health in general.
Even though these are social media.
Right. It's social, but not really, not in the way that we're biologically built to socialize with each other.
Yeah.
So I definitely feel like that contributes. I wouldn't go as far as saying that's causing it, but it certainly doesn't help,
right?
For sure. Because if they're on their screen and they're not doing the things that they can do to make themselves feel better, whether it's picking up a hobby like knitting or going to a yoga class or just go hike in the nature, for example, or preparing yourself a very delicious and very healthy meal, like, right, all the stuff that's supposed to slow you down in life, you're not really allowing yourself to have opportunities to do that.
Right. Yeah. And I think that gets back to the balance of everything.
Yeah.
And one of the a really good resource that we came across recently was the book Dopamine Nation by Dr. Lemke, which was, talks about dopamine and how screens do it, but then also brought up, I think, this really interesting idea about how, using screens gives us more dopamine, but it also works in that balance the other way, where so she has this idea of emotional gremlins. So where when we rely too much on screens, we really ramp up our dopamine. But we have this tendency in all of our biological systems, but this especially called homeostasis, where things try to return to their natural state. And so she has this concept of gremlins where we can fill ourselves with dopamine, but then our bodies naturally just start pushing down on the other side of the seesaw, and we start feeling terrible, even though we have as much dopamine as we want, and it makes it so that our screens are giving us less satisfying dopamine experiences because of it. And that to me is just also the emotional balance being out of whack, and then it sounds a lot like depression when we look at it in that way.
Yeah, right. And when you don't feel the same effect from the same amount of dopamine release, you kind of like naturally want to do more of it and more of it and more of it, just to get that high, quote unquote, right? I mean, that's basically the biological basis behind addiction.
Right.
Yeah.
So if we talk about like how deeply people get into it, like what kind of red flags do you see that make you start worrying, this is more than just, I need to have a conversation about screen time with this person?
Well, in the clinical world, we do have standardized scales that we can use to, screen people for, clinically diagnosable depression, for sure. I think I start to get concerned if it starts to impact their the relationships in their lives. They're not having the conversation they should be having with the people in their lives. I get concerned when it starts to impact their sleep, for example, if they're up all night and scrolling, and then they're telling me, I don't know why I'm in such a bad mood all the time. So I hear that a lot. I get concerned when like their colleagues at work or their bosses start to see the performance drop, and if you dig a little bit deeper, there could be some component of excessive social media use that's at play, that's making them more irritable, that's making them not sleep, and therefore they have less energy, right? So these all things can really tie together and affect each other.
Yeah, I would say that really tracks with teenagers especially. When we talk about teenage depression, all of those things really apply, like just withdrawing from themselves, with their lives, hobbies, sports, academics. If it really impacts anything important, anything close to important in their lives, that's when I start really becoming concerned.
Right. And they feel like they just cannot dig themselves out of that hole. So I hear that a lot. Like, I know I don't want to be in this state, but I don't know how to get myself out of it. Right.
Yeah.
And one of the things I might recommend is, turn off your phone, go out for a hike, go out for a walk, like be in touch with nature.
Something simple like that.
Something simple,
easy to do.
I feel like sometimes the most elegant solution doesn't have to be the most complex.
Yeah,
so.
I agree. And it gives them a little bit of a handle on it. Like says, okay, I don't have to be overwhelmed. I did this one thing. Yeah. Wasn't too bad.
Yeah. I feel like a lot of patients actually are very skeptical of the recommendation they give because they are so simple. They're like, really? I'm going to feel better if I just go out for a walk? It's like, yes, you will. I promise you that.
It's literally the first step to your recovery.
Not that it's going to be the end all be all. It's not a silver bullet, but I think you're going to feel at least 20% better. How about that?
Sounds good. So Seattle area families, hope this helps with screen time difficulties in you and your kids.
Yeah. Hopefully that was helpful. And definitely, if you want more information, if you want to reach out to us, we'll be happy to talk to you more about it.
Absolutely. The other thing I wanted to talk about is some healthcare news. And again, this is something we want to try to educate people on in terms of what's coming up, because you might not have heard about it. But there is going to be a significant rise in healthcare insurance premiums and deductibles, and it's just going to make healthcare more expensive for everybody. And so what I'm understanding is that the trends that have been there for the past 5, 10, maybe 20 years are still there. People are spending more on their health. People are people aren't getting into their primary care physicians, so we have to spend more to keep them healthy. There's more expensive medications, more expensive treatments anyways. But I think the big thing is we, in 2020, as part of the COVID relief package that was passed, there were subsidies for healthcare premiums, and they're expiring at the end of 2025.
That's right. Yeah.
So here in Washington, what I'm hearing is that the insurance companies are asking the Office of the Insurance Commission on average to increase their premiums by 21%.
Oh, wow.
It's a lot.
That's a huge bump.
Yeah. And that's just the premiums.
Right. And not necessarily for better quality or better access, if you really look at it that way, right? More expensive healthcare, but same, maybe worse quality. Because I have to say, I don't know about you, but in my experience, I feel like year after year, I am seeing the quality of care going down, whether it's access, whether it's, the ability to actually get all your needs addressed, or it's cost, right? There are a lot of problems right now in healthcare. And I feel like, unfortunately, things are not really getting better. They're, if anything, getting worse from all the feedback that I'm getting from patients on the ground.
I keep waiting for things to get better, but it doesn't seem to be happening.
No. Right. Well, you're an optimist. I'm more of a pessimist. So
yeah, I agree. I don't think the impact is going to stop at the fact that we're paying more for our premiums. As a rule, I see families say that they can't get in to see their pediatrician. They know they just have to go to urgent care. To see a doctor who doesn't know them, to see a doctor who doesn't know their history, maybe see a doctor who's not as qualified, for pediatrics, maybe they're not seeing a pediatrician to diagnose what may be a complex pediatric, illness, for example. How are you seeing, with your patients, are you seeing any of those issues?
Yeah, for sure. Access is a big issue. I have been, talking to a lot of patients who, before they came to me, they were saying they were waiting like at least a month, if not 2 months, just to get in and get established as a new patient. They're saying that, even as an established patient, they're having trouble seeing their own doctor. And they really do value continuity. I would say most people do, and of course there's going to be a subset of population, they just want convenience, But I would say most people, they really want to see someone who knows them, who knows their history, and not have to like just you spend 5 minutes to read their chart and then like, you know, dash into the room, address their problem, kind of maybe not, and then like walk out all within a span of 15 minutes. I think that's not the healthcare experience people are really looking for.
Yeah.
And unfortunately, it's going to be more and more that way because of all the mergers that's happening in the healthcare industry, right? I feel like in our Seattle area, I feel like all these big system institutions are just buying each other out. They're just merging. And, you know, right? I think the most recent one was, I believe like Overlake and Multicare, they merged.
Oh, right. Yeah,
right.
Yeah.
So I think that unfortunately this kind of really industrialized kind of process and experience is going to be more commonplace. And I think this is in part the reason you and I decided to skip that part altogether and come out and open our own practices, because we don't want that kind of experience for patients.
It's not how I pictured my career being when I signed up for medical school.
Right, you know? Right. Feeling like you're just a cog in the wheel and then you're just doing these corporations' biddings by maximizing profit. Like that is not what I'm here for. And that is not why I signed up to be a doctor. So,
right.
Yeah.
It reminds me of a story of a family member that I knew who broke his back last year. Mm-hmm. And he had great health insurance. Mm-hmm. He called an ambulance. They took him to an urgent care. The urgent care diagnosed him with the broken back, but didn't feel comfortable. So they sent him to a different ER. Mm. When all was said and done, all they could do was just, put him in a brace and then had him follow up with neurosurgery. The problem is that when they got referred to neurosurgery, was in a completely different health system. So these are two large health systems that saw him. The transfer of information wasn't great. So like the neurosurgeon had to start all over, ask everything that happened. And then, over the course of like a 3 months of follow-up, the neurosurgery provider left. And
oh, wow.
This was a huge corporation with lots of other providers, but no one really following individual patients.
Yeah.
And no one set up this family member with somebody else to follow up with. So, and because all the other providers had wait lists, he was an established patient that went 6 months between follow-up when he should have been seen 6 weeks after that first appointment.
Yeah.
It's just really difficult when the system is getting this stressed.
Yeah. And because we do have a very complex healthcare system, and I think that's where primary care can really shine. Having a good primary care provider, whether it's a pediatrician or family doctor, really does help you navigate this really complicated system.
Yeah.
Right. Actually, in the past couple months, I have had a few patients came to me because they just felt like they couldn't navigate it anymore. It was like, I think they were trying very hard. They had good insurance plan. They had PPO plans, which means you don't need a referral to go see specialists. And so they were just trying to like do it on their own and try to like pick and choose like specialists. But at some point she's just like, I'm not sure I know what I'm doing anymore. And I need some help. I'm like, great. Yeah. This is where I come in.
Yeah. Yes. And I mean, I don't think I signed up for this part of when I signed up for medical school either, but it is such a vital part to healthcare these days, is just helping people navigate, the name of the specialty, like,
right.
Or like figure out how to best get the benefits from their insurance.
Right.
It's just so challenging.
I think the way I explain to patient is like, it's almost like the specialists, they all are feeling a different part of an elephant. So they can tell you what an elephant looks like based on what they feel, but they don't really have the complete picture.
Yeah.
But primary care providers do.
Yeah.
That's the beauty of like primary care, is that we have that vantage point where we can see the whole picture and not just see parts.
I really like that analogy. Yeah. Like we want to see the whole picture.
Yeah.
And in the direct primary care world maybe we should talk a little bit about what that is. So how do you explain direct primary care?
Well, I think that there is sort of a more process-based logistical kind of explanation in terms of like, how people might finance a direct primary care, and that, it's a membership-based model, which means that we bypass insurance altogether. We don't want to play that game because ultimately we want patients to be our boss and not the insurance company to be our boss. Right.
Amen.
Yeah, exactly. So I tell them that, it's like a membership that you pay usually every month, but sometimes for some practices it's every quarter or every year. And that will cover all your visits with us, all your interactions with us, whether it's online, offline, in person, sometimes even home visits, paperwork that you have to fill out. It's all included. So you don't have to ever feel like you need to like figure out how much things cost for every move that you make or every interaction that you have with us. That's the beauty of it. It really simplifies it so that you don't have to worry about like, oh, should I go to Dr. Park because that visit might cost me another $400. You know, it's like, hey, it's all covered.
And I mean, and one of the things that we see when healthcare gets more expensive is people don't see anybody because of they're worried how much it'll cost. And so not only is there transparency in the direct primary care model, but the access lets us treat you when it's a smaller issue before it becomes a big one. Are you seeing adults forego their care, before they come to you? Are you seeing how that impacts their health?
Oh yeah, absolutely. I see adults, in the traditional setting that they are less likely to reach out if they had issue. They'll usually try to just Google it and solve it on their own, and then wait until things are really catastrophic, then lands in the emergency room, which really isn't the ideal scenario, right? Usually you want to like treat the problem before they become too big to handle. So unfortunately, I do see that. Or like people just getting lost in the shuffle because they don't know like where to go, how to navigate this, all these lingo you have to kind of figure out what they mean when you sign up for a plan, right? It is very complicated.
Thankfully, I don't see parents usually delay their kids' care too much because they can go to urgent cares. But what that means is that, like you said, nobody's seeing the whole elephant. So you get this piecemeal care, and things do get dropped. And medications get added, and that may or may not be helpful for their chronic conditions, things like that. So
yeah, I always tell my patient context is everything in medicine. So yes, we do have AI now. We have Dr. Google. You can theoretically go online and look up your symptoms and try to figure out on your own. But again, the computer doesn't know you. It doesn't know your social context. It doesn't know your medical history. You can try to put that into the prompt like as much as you can, but it's not going to beat having someone knowing you as a person and knowing your history. Yeah.
And I like the idea that we in the direct primary care world are trying to make it as easy as Googling. Just call us, just text your doctor.
That's right.
And you can avoid all of this about not being able to see, not knowing how much you're going to pay, not being able to see a doctor, not being able to see a doctor that knows you. We can help. We're there.
Yeah. I think that's another way that I like to explain to patients about what direct primary care is that if you're really looking to establish long-term relationship with a provider and interact with a human without all these barriers and walls, then direct primary care is for you.
And that's why I signed up in medical school.
That's exactly what I wanted to do. Exactly.
Yeah. So yeah, with the way that paying for healthcare is these days, with how difficult and unpredictable and expensive insurance is getting, there's not a great solution. We're trying to be part of a different solution. We're definitely not trying to be part of the problem.
Yeah, no, absolutely. Because I think ultimately, people just want to get good care, right? Yeah. I feel like, sure, like healthcare is expensive, but at the end of the day, if you can get great care from that, I think people are probably willing to spend some money on it. But I think the problem is people are spending a lot of money but not getting great care.
Yeah.
Right. I think that's really the problem at heart. So yeah, hopefully, I think DPC will probably become more popular, I think, down the road, because as I alluded to earlier on, I think quality of care is starting to go down, especially in primary care from my vantage point, from what I'm seeing. So I think DPC can very much be part of the solution. Not saying we have to get rid of insurance altogether. Insurance still has a role, but the way I like to kind of explain to people is that, use DPC like 80% of the time, right? And the 20% of the time when you have like emergencies where you need to be hospitalized, sure, insurance is there for you, but let us do most of the heavy lifting for you.
Yeah, that's right. And we could maybe talk in a future episode about how exactly DPC can fit in a world with insurance in a way that makes even more sense than the system we got now.
That's right. Yeah.
So as we come to an end here, we would love to get more involved in the community. So follow us on our socials. We'll put them here right on the screen. And if you have any suggestions for future topics or questions you would like us to answer, send them in. You can send them into our Instagram or Facebook, or you can even call or text our offices. In fact, I'll put an email too here if you'd like that you can reach out to.
Yeah.
All right. Sounds good. First episode.
Yeah.
Yay.
Yay.